What will the coming weeks hold for Secretary of State Hillary Clinton following treatment of a blood clot in her head? We have two experts in the medical field to help us weigh in here on the News Hub. The first is Dr. Narayan. He is neurosurgery chair at North Shore University Hospital in Manhasset, New York. We also have Tom Burton. He reports on the medical field for us at the Wall Street Journal. He's based in Washington, D.C. Thank you so much to you both for being with us, and Happy New Year. Tom, let me start with you. What is the current state of affairs with Secretary of State Hillary Clinton? What do we know? I know information has been a bit difficult to come by about her condition.
Yeah, it has been difficult to come by, largely because the Team Clinton won't really let the hospital or the doctors talk directly to the press, which is kind of unusual. But as best we can tell, she's fairly stable. She's being treated for a clot in the right transverse sinus, which is a vein that drains that side of the brain. She's being treated with blood thinners such as heparin, and we're told that the prognosis is very likely to be good.
Dr. Narayan, let me let you weigh in here right now. I mean, the former First Lady was taken to New York Presbyterian Hospital, Columbia, in New York City on Sunday. Describe for us in layman's terms the type of clot and sort of how a clot like this can form and what the blood thinners they're doing are actually trying to accomplish right now.
The clot is inside the vein, and the reason for the blood thinners is to try to prevent the clot from getting any bigger. Obviously, the size of the clot and its location right now is compatible with the secretary being completely awake and normal. However, if the clot were to become larger and to block off the other side, then that could be very dangerous. And that's why the doctors have been treating her with the blood thinners in order to prevent the clot from becoming larger and spreading to the other side.
In a circumstance like this, doctor, how do they know how well the drugs are working? What sort of a time frame are they on, and how will they examine her? What kind of imaging will they use to see if the clot is shrinking?
The most commonly used, and understand that this is a rather uncommon condition, but the most commonly used diagnostic test in this setting would be an MRV, which is a venogram picture obtained with an MRI scanner. And that is how they found it, actually, is by doing an MRV and seeing that Secretary Clinton had developed a clot in the transverse sinus on the right side.
Tom, take us back here for a moment and describe how this blood clot came to be, as best we know and as best you have been able to deduce from talking with other medical experts in the field, how this clot came to be in Hillary Clinton's head.
Well, there's a chicken and egg phenomenon as to whether the clot preceded the fall and concussion that she underwent a few weeks ago, or whether the fall and concussion caused the clot. I think in this case I've been able to determine pretty clearly that doctors believe the clot resulted from the concussion and the fall, and it resulted largely from possibly a hairline fracture in the bone adjacent to the vein. And when that fracture heals itself, the new bone cells can irritate and agitate the vein. The vein gets inflamed, and inflammation either causes or dislodges an existing blood clot.
And just to recap for folks who may not have followed this, Mrs. Clinton had fallen ill after from a stomach virus that had resulted after a European trip earlier in December. That virus had led to some dehydration, which then caused her to faint and fall and suffer this concussion. Dr. Narayan, let me jump back to you. At what point do the doctors say the blood thinners are working well enough, she can be released, and once she is released, what kind of treatment do they continue at that point?
So the purpose of keeping her in hospital is to get the blood thinners to start acting adequately. And there are usually two different types of blood thinners that are used. One is heparin, and that is used initially to get the blood thinned out, so to speak, immediately. And then Coumadin or some equivalent off Coumadin, which is used on a more long-term chronic basis and is given by mouth. So typically you start the patient off on both these medicines, and then once the Coumadin starts to act, and that typically takes 3, 4, 5 days, then the heparin is stopped and the patient is left on Coumadin. And generally, in this particular condition, the Coumadin is continued for typically 3 to 6 months.
Okay.
The only way to know whether it is working adequately, other than seeing the patient's clinical condition, is to repeat the MRV on a periodic basis.
All right, Dr. Narayan, Tom Burton, thank you both for your expertise. We will continue to bring you the latest updates on Secretary of State Hillary Clinton's condition on WSJ.com.